Hey everyone, for skill 3, there are 2 reasons that your patient may have a tube inserted into their stomach. The first one being enteral nutrition for feeding purposes, and the second being decompression, and that is when we are going in and trying to actually take something out of the stomach. So the tube will be in there for either one or the other. It will never be for both. We will never be feeding and using decompression at the same time. We can do both of these things with a couple different types of tubes. So the first one we're going to talk about is the NG tube nasogastric. It's going to go in through your patient's nose and go down into the stomach. The second one is the nasointestinal NI tube. So that one's going to go in through their nose as well, but it's going to bypass the stomach and go into the intestines. We're going to see these used with patients who are having trouble absorbing their food and they're at a high risk for aspiration. So we're going to bypass the stomach, go into the intestines. That way we know the food is getting absorbed and not regurgitated. The third one is the PEG tube, and this is a tube that is going to be surgically placed into the stomach by the physician. So if we are feeding a patient through a tube, they are digesting and absorbing their food normally. There's nothing wrong with that. The problem comes in when they are ingesting, chewing, they can't swallow safely, or maybe they're just not intaking adequate amounts of food, and this tube is going to help them meet their nutritional requirements. Some patients that we typically see with this are post-stroke patients and dementia patients. They usually truly benefit from this, and we consult with a dietitian to get a calculation of their nutritional requirements. Okay, so our second reason for inserting the tube is decompression. These patients are having trouble emptying their stomach. Maybe it's a bowel obstruction, or maybe their peristalsis is just slowed down or even absent. Regardless, they are not having food and liquids move through their intestines. It is blocked up. It's causing them a lot of discomfort. You may see their abdomen very distended. They're typically nauseated. They might be vomiting. So what we're going to do is we are going to insert the tube, and then we are going to connect that tube to the suction canister and wall suction. So when we turn on the suction, everything that is in that patient's stomach is going to start getting sucked out, and you're going to monitor it in the canister. So when you're looking at the canister, you're looking at what's coming out, the consistency of it, the color of it, and how much of it. So patients may stay on suction for a couple days while we give the body time to heal itself, and we hope that when we take the pressure off, the bowel obstruction fixes itself. If after a couple days it doesn't fix itself, usually the physician will take the patient to surgery and surgically remove the obstruction.